Welcome to the second podcast of the journal Endoscopy, bringing you highlights from the June issue. We hope you will find them interesting and useful. Laparoscopy is an established method for diagnostic staging of intra-abdominal cancers such as esophageal, gastric, biliary, and pancreatic cancer, and sometimes also of hepatocellular carcinoma, colon cancer, and lymphoma, and is indicated in patients who are candidates for curative surgical resection. In pursuit of the goal of a completely incision-less diagnostic approach, methods have been developed for endoscopically accessing the peritoneal cavity using the natural orifices of the body, namely the mouth, vagina, or rectum, a method designated as NOTES, that is, natural orifice transluminal endoscopic surgery. The question arises if this goal is an end in itself. Is a diagnostic method for peritoneal or colon cancer staging that avoids any skin incision always better than one which involves minimally invasive surgery? This is the issue that has been addressed by von Renteln et al. They performed a study in a porcine model comparing laparoscopy with NOTES in terms of the performance in enabling complete organ visualization, detection of peritoneal lesions, and the ability to perform biopsies. Here is what they report in the recent paper in the June issue of Endoscopy entitled "Standard Diagnostic Laparoscopy is Superior to NOTES Approaches. Results of a blinded, randomized, controlled porcine study." The use of transluminal endoscopic access via the stomach or colon for flexible diagnostic peritoneoscopy has been proposed, although the diagnostic value of the technique has not yet been fully clarified. In this animal trial, the two main natural orifice transluminal endoscopic surgery approaches, transgastric, that is TG, and transcolonic, that is TC, were compared with standard transabdominal access using both rigid TAR and flexible instruments TAF for diagnostic laparoscopy. A total of 48 peritoneoscopies were performed using two randomly assigned approaches in 24 anesthesized pigs. The ability of the examinations to detect 576 electrocautery markings simulating intraperitoneal metastasis, to achieve complete organ visualization, and to simulate organ biopsies was analyzed. Sensitivities for the detection of lesions were 78.5%, 59.7%, 48.6%, and 38.9% for TAR, TAF, TC, and TG respectively. Standard laparoscopy was superior to all other approaches, with a p-value of less than 0.01. Among the NOTES approaches, TC was superior for examining the upper abdomen, with a p-value of 0.03. Complete organ visualization was better with the transabdominal approach. Visual analog scale TAR 7.15, TAF 6.71, than with the NOTES access routes TC 5.07 and TG 4.35. Standard rigid laparoscopy was superior to both NOTES approaches, with a p-value of less than 0.01. Organ biopsy simulation was possible in 87%, 85%, 72%, and 65% of cases with the TAR, TAF, TC, and the TG respectively. Standard rigid laparoscopy was again superior to both note approaches. TAR versus TC, p-value of 0.03, TAR versus TG, p-value of less than 0.01. In this experimental trial, rigid standard laparoscopy provided better organ visualization, better lesion detection, and better biopsy capability than the transgastric and transcolonic note approaches. In its current form, note appears to be unsuitable for diagnostic laparoscopy.